Hi there, it's your general practitioner, Dr. Yvette, and today I wanted to talk about a bacteria that is notorious for causing gastritis and peptic ulcers. So this bacteria is called H. pylori or Helicobacter pylori. Now, half of the world's population is actually infected with H. pylori, but not everyone shows symptoms. So it's a very interesting bacteria, and you're gonna see why. So, how is this transmitted? H. pylori is transmitted through the fecal oral route. So if you ingest anything, food, if you take a beverage that has been contaminated with fecal matter from an infected person, you may get an H. pylori infection. So H. pylori can survive in the stomach. Now the stomach is acidic. Most bacteria is killed by the acid, but H. pylori survives the bacteria. So H. pylori has an enzyme called urease. So urease is able to convert urea that's in the stomach to carbon dioxide and ammonia. So ammonia is alkaline. So alkaline plus acid, they become neutral. It neutralizes. So that's how it survives. Now, the lining of the stomach has a layer of mucus. So this mucus protects the cells of the stomach from getting in contact with the acid. So H. pylori has flagella. Remember how the sperm is, it has that little tail that helps it move? Yeah, H. pylori has something similar. So this helps it move through the mucus and it goes to the cells of the stomach, of the lining of the stomach. So when it gets to the lining of the stomach, it attaches to the cells and it starts producing toxins. Now these toxins are harmful to the cells. So the cells become inflamed. There's inflammation of the lining of the stomach, which is called gastritis. So inflammation of the lining of the stomach is called gastritis. So if this inflammation goes on and there's erosion of the lining of the stomach, a wound is formed and it starts becoming deeper and deeper. That is what is called now an ulcer. So, and the thing about these ulcers that are caused by H. pylori in the stomach, because of this chronic inflammation that happens when you have H. pylori, these ulcers tend to become cancerous. And this is how you find people getting things like stomach cancer because of H. pylori infections that were left untreated. So they had this chronic inflammation of the stomach, of the lining of the stomach, and it predisposed them to getting that cancer. So, what are some of the signs and symptoms of H. pylori? So, you may notice that you have abdominal pain, you may have diarrhea, vomiting. They're really non-specific. Uh, you may have um, you may have bad breath. So, remember, I said that it produces ammonia. So, ammonia is not a very good smell. It's quite a pungent smell, like the smell from urine or the smell from sweat. There's that pungent smell. So you may notice that you have a bad breath, um, abdominal pain, like a burning sensation in your stomach. All those things could be signs of an H. pylori infection. You may have nausea, very non-specific symptoms. So how do we investigate you when we suspect that you have an H. pylori infection? The most common test that we do is called the H. pylori antigen test. So um, this test is done on stool. So this is where they look for the antigen from the H. pylori. Yeah. Then the other test, which we don't normally do here, is called the carbon 13 urea breath test. So yeah. So treatment of H. pylori infection. So because your stomach has that chronic inflammation, inflammation will lead to an increased secretion of acid. Even though yes, it's producing ammonia, but because of that inflammation, you end up producing a lot of acid, which is also not good. So we give you a medication uh, that is a proton pump inhibitor, which reduces the amount of acid that you produce. Then we also give you a combination of antibiotics that target the H. pylori infection. So that is how we treat it. So if you suspect that you may have gastritis, visit your nearest health facility. You may just have an H. pylori infection. Bye.